Hi, Mrs. Smith. Cole and Felix are doing great. I just want to go over a few things with you before I go back and grab them. So I do have this sheet for you that I have to refer to because I know that this is a lot of information to remember, especially because you are taking care of two animals. So Cole and Felix did both get detailed oral exams today under anesthesia, and this includes polishing above and below the gum line. We also went ahead and took full mouth radiographs of all their teeth. Before we go over Cole's dental, I do just want to quickly inform you about periodontal disease. Periodontal disease is the inflammation and infection of gum and bone that surround and support the teeth. So in veterinary medicine, we do have a scale that we grade dental disease on, and it goes from a 0 to a 4. 0 is healthy and normal gums with no tartar on the teeth, to a 4, which is extensive tartar, severe inflammation with tooth and bone loss. In grade 4 periodontal disease, bacteria has also gotten in those gums and now starting to spread through the bloodstream, which could damage the heart, liver, and kidneys. Grade 2 periodontal disease is a step up from grade 1. This is when the mouth is really starting to hurt and the entire attached gum is inflamed and swollen. Grade 3 is somewhere in the middle. This is where tartar and calculus is now starting to destroy some of that gum tissue. So Cole did have a lot of tartar and calculus buildup on all of his teeth. So that just means that a lot of bacteria has gotten down in those gums and is now starting to cause some problems for him. Cole currently does stand at a grade 3 for periodontal disease, so he is at a moderate stage where bacteria is starting to affect the tooth root and bone underneath the gum line. This could also be the cause of the stinky breath that you said that you mentioned and why Cole is having a hard time eating his kibble. So we did go ahead and extract 12 of Cole's teeth today. This includes the chipped canine on his upper left side and a big premolar on his lower right side that had a similar problem. This is going to be a massive relief to him because anytime he chews or eats something, he won't be hurting anymore. And I do know this sounds scary, but with daily upkeep like toothbrushing, none of this is going to be an issue for Cole. As for Felix, she falls on the scale at a 1, so her teeth look pretty good today. She just had some mild inflammation of the gums, so we did not go ahead and extract any of her teeth today. So we will be giving Cole pain medication just to keep him comfortable because he got so many extractions, and we want to give him antibiotic just because we want to keep bacteria out of those gums and stop it from infecting them. Both Cole and Felix are going to feel a little groggy today. That is completely normal. You can expect this from them for about 24 to 48 hours. Because they're going to be a little bit more disoriented than normal, they are going to be a little bit more prone to injury during this time. So we just want to keep them in a calm, relaxed area for the next few days. Cole shouldn't be jumping in and out of your vehicle for now or on top of furniture inside the house. We also want to just monitor Cole very carefully if he has to go up and down stairs inside the house, just because we don't want him to slip or anything bad like that. For Cole's extractions, he does have sutures in his mouth. These do not need to be removed. They'll either dissolve or fall out all on their own, and that will take approximately 2 to 4 weeks. So we just want to avoid touching his gums, trying to look at those incisions, lifting up his lip, just because that could irritate the gums or move those sutures, which we really don't want to do. Regarding Cole's food, he will need to be eating soft canned foods for the next 10 to 14 days. He is perfectly fine to eat soft treats. I'm sure he would love those. Hold off on feeding him tonight and large amounts of water for 12 hours after anesthesia, just because this could cause some nausea or vomiting, and we don't want that. If you see small amounts of blood in his water dish after he finishes drinking, that is completely normal. But if you do see large amounts of bright red blood, please give us a call. Since Felix didn't get any extractions today, she can return to her normal diet. She might have a lack of appetite for the next day or so, which is completely normal. And when she does start to feel hungry again, just feed her normal food, but start off in smaller increments and just work your way up. And I do know this is a lot to remember, so I have it all written on that sheet that I gave you. For Cole's exercise and playtime, we just want to prevent him from getting too rowdy within 48 hours of anesthesia. Most animals feel groggy and sleepy the next few days, but you could find Cole being more vocal than normal, and that is perfectly fine. We just want to keep him calm for the next few days. I also know that you do have Princess at home. From what I can remember, she does get very excited. So if you think that she's bothering Cole or Felix too much, I do suggest that you separate them. And that is only going to be for the time being, just a day or so, until they both get their energy levels back to normal. So for Cole, this unfortunately means no tug of war for the next 2 weeks. And we also want to just prevent him from chewing on any of his toys, or anything hard that he likes to put in his mouth, like a stick or rock from outside. When he does start getting back to his normal energy levels, a light exercise is recommended, like a gentle walk or play in the backyard. For Cole's medication that I mentioned earlier, we are going to be giving him clindamycin for an antibiotic, and that is going to be 2 capsules every 12 hours until the bottle's empty. For pain medication, we are going to be giving him carprofen, which is 1 tablet once daily for the next 7 days. So if he does start vomiting or having diarrhea on any of these medications, please stop giving them to him immediately and give us a call. So Cole is going to need a recheck exam in the next 2 weeks, and that's just because we want to look at his mouth, make sure everything is healing all right. During Cole's recheck exam, we do want to discuss things like daily brushing, just because he already has moderate damage to those teeth. So we just want to prevent that from getting worse or progressing any further. Daily toothbrushing, just 1 to 2 minutes a day, is going to be the ticket to stop Cole from getting any further damage to those teeth. And I know cats can be finicky, but if you can get inside Felix's mouth for daily toothbrushing, that would also be great for her. We just want to really emphasize preventative measures, and because she's only at a grade 1 periodontal disease, we want to stop that from getting worse. So toothbrushing for Cole and Felix is both very important. For both Cole and Felix, oral exams are also about every 6 months. So they'll be getting that in another 6 months' time. And a dental cleaning under anesthesia is done every year. Last but not least, just some things you want to look out for, some symptoms. For instance, not eating for an extended period of time, more specifically 48 hours, over 48 hours. Refusal to drink for more than 12 hours. Vomiting, diarrhea, excessive swelling or bleeding. And then you also know your pets the best, so if you think that either of them are in a depressive mood, like Cole doesn't want to go play outside with you, or Felix doesn't have her normal attitude, please give us a call. And I think that is going to be it. I'm sure they can't wait to go home, so I'm going to run back and grab them for you.